Welcome all, and thank you for joining this presentation on the Nphies Clinical Services General Awareness Session. The agenda covered during this presentation will be Nphies Clinical Services Project Overview, Nphies Prerequisites, Nphies Clinical Services Use Cases, Single Sign-On to Nphies Embedded Mode, and Nphies Integration References. Let's begin with an overview of the Nphies Clinical Services Project. Nphies Platform stands for the National Platform for Health and Insurance Exchange Services. This platform has been launched by the Council of Health Insurance (CHI), SAHADI, and the National Center for Health Information (NHIC), under the patronage of the Ministry of Health (MOH). There are two scopes of Nphies: insurance services and clinical services. Our focus is on the clinical services scope, which will be fulfilled during this session. The vision behind Nphies implementation is to transform the healthcare landscape in the Kingdom of Saudi Arabia by utilizing technology to enhance the standard and quality of health services, and by having Nphies implemented will have a standardized, unified, and clean data that will accelerate the achievements of connected healthcare. The core vision behind the implementation of the Nphies is to transform the healthcare landscape across the Kingdom of Saudi Arabia by utilizing technology to enhance the overall standard and quality of health services provided to the population. The key to realizing this vision is the creation of a standardized, unified, and clean data ecosystem through Nphies Platform. This centralized repository of patient information will serve as the foundation for a truly connected healthcare system. This slide showcases a diagram that depicts the journey of integration and its desired outcome. The diagram is divided into two main sections. The first section represents the current state of health information, which is scattered across multiple sources. This fragmentation makes it challenging to access and manage crucial health data efficiently. However, the second section of the diagram represents the future transformation that we aim to achieve through integration. This transformation involves centralizing health information into a single, unified platform. By achieving this, we can streamline the entire system, making it more efficient for both healthcare providers and patients. Nphies has three core objectives that aim to transform the healthcare landscape in the Kingdom of Saudi Arabia, which are improving the efficiency by enabling real-time availability of patient medical data. Additionally, enhancing the accessibility by having a standardized, unified, and centralized data domain that is accessible to all stakeholders, which eventually will help in improving the speed, quality, safety, and cost of patient care. To be integrated with Nphies Clinical Services, there are prerequisites must be completed before. First, the integration with the registries, including patients and provider registries, exemplifies the source of information and identifiers for patients and healthcare providers. Secondly, compliance to the clinical requirements. Nphies clinical standards are designed to enable patients' clinical information to be shared according to a uniform and consistent standard throughout range of national healthcare organizations. This is done through unifying different medical terms and semantics that may have existed in different hospitals. Such unified standards can allow systems to communicate even if they have different interfaces and platforms or use different local codes. The mapping activity or the clinical requirements compliance in Nphies project aims to help hospitals to be sure that all the terminologies they use are mapped and consequently exchangeable with the codes in other hospitals. Nphies clinical standards including ICD-10 for diagnosis, ACHI for procedures of health interventions, SNOM for allergy, ACHI for oral health procedures in inpatient settings, whereas ADA for outpatient settings, LOINC for laboratory tests and orders, NISP for radiology orders, NHIC registry, MRID code for medication, and IS-0200 Saudi Data Dictionary for interface specifications value sets that mentioned in the interface specifications document that will provide you with guidance on the integration for each use case. The clinical services use cases are a core component of this platform, addressing the diverse needs of healthcare providers, patients, and other stakeholders. I'll provide an overview of the key use cases in this section and discuss the objectives and benefits of each one in more detail. Nphies Clinical Services use cases involves the encounter history, clinical notes, laboratory results, radiology reports, and images. The data resource for these use cases is the participant healthcare organization's health information systems as well as participant healthcare organizations' PACS for the radiology images. Additionally, the medication use case involving both e-prescribe and e-dispense, radiology order, laboratory orders, referrals, immunization card, and IEHR summary use cases. The data resource for the medication use case is the participant healthcare organization's health information system in addition to the external system, WASFID. Also, the lab use case is the participant healthcare organization's health information system in addition to the external system, IANATI. Whereas for the radiology order, the data resource is the participant healthcare organization's health information system. Additionally, the external systems referrals and HESN are the data resources for referrals use case and the immunization card. Ultimately, Nphies Clinical Data Repository will be the resource for the IEHR summary. The first use case is the encounter history use case. The key objective of the encounter history use case is to provide access to a comprehensive, chronological history of all patient encounters with the healthcare system. This includes data on patient admissions, discharges, transfers, outpatient visits. The technical implementation to achieve this objective is based on the ADT HL7v2 integration interface. Specifically, the participants such as hospitals, clinics, and other care providers will send ADT messages from their own systems to Nphies platform. These ADT messages are triggered by standard HL7 events, like ADT01 for patient admissions and ADT03 for patient discharges or end of visits. The clinical implementation of the encounter history is based on compliance with the following standards: ICD-10-AM for diagnosis, ACHI for procedures of health interventions, SNOMED for allergy, and ACHI for oral health procedures in inpatient settings, whereas ADA for outpatient settings. In addition to the interface specifications value sets regarding the IS-0200 Saudi Data Dictionary. Alright, let's now shift our focus to another important use case, the clinical note use case, including outpatient encounter, discharge, newborn discharge, maternal discharge, and the operative note. The clinical note use case enables the creation and sharing of clinical notes and summaries through the Health Information Exchange platform to support transitions of care, providing timely access to this information for healthcare stakeholders, and allowing the clinical summary data to be used for patient encounters and surgical documentation. The main workflow for the clinical notes use case is that the healthcare provider will publish the clinical notes documents to Nphies services, as well as the organization will be able to retrieve patients' clinical data. For detailed information regarding the build requirements of the interface, please refer to the latest interface specification document. For the clinical requirements that are needed to implement the clinical notes use case, please refer to the mapping guide, which will provide the requirements including Nphies standards and value set. Now, let's delve into the details of the laboratory results use case. The key objective of the laboratory result use case is to enable healthcare organizations to share laboratory results effectively. The benefits of this use case are: it produces laboratory result reports in both human-readable and machine-readable formats. It provides timely access to laboratory result reports across all stakeholders. It helps reduce errors in patient care by making it easier to access prior laboratory result reports. It allows organizations that previously did not have access to now access structured, coded laboratory results. For the laboratory results use case workflow, there are 3 scenarios. The first scenario is in the case when the healthcare organization is not integrated with IANATI, the Health Information System will publish the lab results to Nphies, as well as will be able to publish the amended lab results. Whereas in the second scenario is when the Healthcare Information System is fully integrated with IANATI. Thus, the Health Information System will publish both the lab results and the amended document, if have any, to IANATI, then it will be published to Nphies. The last scenario is if the Health Information System is partially integrated with the external system, IANATI. The healthcare organization must adjust the interface and filter the data received through the external system in order to send to Nphies only the lab results and related amendments that are entered internally within the healthcare organization. The clinical implementation of the laboratory results is based on compliance with LOINC standards for laboratory tests and observations made in any setting, in addition to the required interface specifications value sets concerning the IS-0200 Saudi Data Dictionary. Now that we have covered the key details of the laboratory result use case, let's move on to discussing the laboratory order use case. The laboratory order use case aims to enable the sharing of laboratory test orders and the initiation of coded laboratory orders, making them accessible through the National Saudi Health Information Exchange platform. The key benefits of this use case are: it provides timely access to laboratory orders across all stakeholders. Additionally, it helps reduce the duplication of placing laboratory orders. Moreover, It allows organizations that previously didn't have access to now access laboratory orders. For the laboratory order use case workflow, there are 3 scenarios. The first scenario is in the case when the healthcare organization is not integrated with Ionati, the health information system will publish the lab order to Nphies, as well as will be able to publish lab order status updates. Whereas in the second scenario is when the healthcare information system is fully integrated with Ionati. Thus, the health information system will publish both the lab order and the lab order status updates to Ionati, then it will be published to Nphies. The last scenario is if the health information system is partially integrated with the external system, Ionati. The healthcare organization must adjust the interface and filter the data received through the external system in order to send to Nphies only the lab order and the lab order status updates that are entered internally within the healthcare organization. The clinical implementation of the laboratory order is based on compliance with LOINC standards for laboratory orders. In addition to the required interface specifications value sets concerning the IS-0200 Saudi Data Dictionary. In the next section, we will cover the radiology report use case, followed by the radiology order use case. The objective of the radiology report use case is to enable the sharing of images and reports acquired through various imaging modalities. The benefits of this integration include timely access to a patient's imaging studies and diagnostic reports across different healthcare facilities in KSA. Additionally, this integration reduces the need for duplicate imaging tests and facilitates the sharing of images for remote teleradiology services. The main workflow for the radiology report use case is that the participant health information system will publish the radiology report to Nphies platform, as well as the organization will be able to publish amended report. For detailed information regarding the build requirements of the interface, please refer to the latest interface specification document. The clinical implementation of the radiology report is based on compliance with NIC IP code set with Saudi extensions. In addition to the required interface specifications values sets about the IS-0200 Saudi Data Dictionary. For the radiology order use case, the main focus is on the ability to share radiology orders and their status updates through the National Saudi Health Information Exchange (HIE) platform. The objective is to provide timely access to radiology orders for various stakeholders. This integration aims to reduce duplication of radiology orders and ensure efficient coordination among healthcare providers. Additionally, this use case allows organizations that previously did not have access to radiology order information to now obtain it. The main workflow for the radiology order use case is that the participant health information system will publish the radiology orders and their status updates to Nphies. In the medication section, we will be discussing the medication use case, including the e-prescription and e-dispensation. The medication use cases, prescription, and dispensation aim to provide the electronic recording of prescriptions and dispensation of medications to improve patient care through healthcare providers' access to a patient's medication information. The key benefits of these use cases include providing a centralized electronic prescription record that supports healthcare providers in prescribing at one location and dispensing at another, reducing errors in patient care related to misspelled or unclear medication information, introducing a national, uniform, and harmonized way to record prescription information and medication dispensation, enabling a consistent interpretation and dispensing of prescriptions, contributing valuable medication information to the patient's comprehensive medication history, which can be used for medication reconciliation and review. Having this information in one location allows for more effective drug interaction checking and enables centralized medication lot/batch information tracking, enabling the quick and efficient location of patients who may be taking specific drugs that could have adverse effects through the centralized tracking of medication lot and batch information. Centralizing medication data to support program planning and drug utilization activities at an aggregate level. For the medication e-prescriptions use case workflow, there are 3 scenarios. The first scenario is in the case when the healthcare organization is not integrated with the external system, WASFA-T. The health information system will publish the prescription to Nphies, as well as will be able to publish prescription updates and/or amendments. Whereas in the second scenario is when the healthcare information system is fully integrated with external system, WASFA-T. Thus, the health information system will publish both the prescription and the prescription updates and/or amendments to the external system, WASFA-T, then it will be published to Nphies. The last scenario is if the health information system is partially integrated with the external system, WASFA-T. The healthcare organization must adjust the interface and filter the data received through the external system in order to send to Nphies only the prescriptions and their updates and/or amendments entered internally within the healthcare organization. For the medication e-dispensation use case workflow, there are 3 scenarios. The first scenario is in the case when the healthcare organization is not integrated with the external system, WASFA-T. The health information system will publish the dispensation to Nphies, as well as will be able to publish dispensation. Whereas in the second scenario is when the healthcare information system is fully integrated with external system, WASFA-T. Thus, the health information system will publish both the dispensation and the dispensation updates to the external system, WASFA-T, then it will be published to Nphies. The last scenario is if the health information system is partially integrated with the external system, WASFA-T. The healthcare organization must adjust the interface and filter the data received through the external system in order to send to Nphies only the dispensation and its updates that are entered internally within the healthcare organization. The clinical implementation is based on compliance with the required interface specifications value sets regarding the IS 0200 Saudi Data Dictionary. Next section will be discussed the technical implementation of Nphies supported interfaces, which are published as well as query and retrieve interfaces. The technical standards that are supported in publish interfaces with Nphies integration are HL7 version 2 standard for implementing the encounter history use case, and for the CDA use cases, the standard supported is IHE XDS ITI 41, which are discharge summary, outpatient encounter summary, maternal discharge summary, newborn discharge summary, operative notes, lab results, radiology reports the standard. Moreover, the HL7FHIRR4 standard is the applied standard to submit prescribed or dispensed medication to Nphies. While for query interfaces, at any time, a participant may query for patient documents using the query document set, ITI 18, as a precursor which in return retrieves the queried individual documents via the XDS Retrieve Document Interface, ITI 43. Healthcare providers may search for any of several types of documents including outpatient encounter summary, discharge summary, maternal discharge summary, newborn discharge summary, operative note, laboratory orders, laboratory results report, radiology orders, radiology report, referral, and the IEHR summary. IHEITI 18 Registry Stored Query Transaction is the transaction for querying CDA documents in the Nphies platform. It returns handles to the found documents, XDS document entry, which can be used to retrieve those documents in a follow-up step which is mainly maintained by IHEITI 43 Retrieve Document Set transaction for retrieving CDA documents from the Nphies platform. In the next section, we will be discussing IEHR summary and its ability to create and share clinical summaries to transition patient care through the Health Information Exchange platform, Nphies. To create an IEHR summary, the content creators, such as healthcare providers, must reconcile a full summary of the patient's medical information as part of the content creation process. This can be done by querying the patient's IEHR summary through an interface or by visually reconciling the information on the Nphies provider portal. The key benefits of the IEHR summary include generating dynamic summaries of clinical data based on the clinical documents in the HIE document repository, providing access to the patient's current health status for all summary document use cases in Nphies platform. The IEHR summary includes patient demographics and relevant clinical data that can be imported and reconciled with the local system to ensure accurate and up-to-date care information for the patient. The IEHR summary allows healthcare participants to synchronize the clinical data with the comprehensive patient records maintained by the Nphies Health Information Exchange platform. Participants can query for a patient's IEHR summary using the patient's NHIC Health ID, which provides summary of the patient's clinical data, including problems, medications, allergies, immunizations, lab results, vital signs, blood type, and surgical history. This summary serves as a complete and up-to-date overview of the patient's health status, enabling providers to ensure accurate and coordinated patient care. The main workflow the healthcare provider will query using ITI 18 standard of specific or list of documents, and it will be retrieved using ITI 43 standard. The immunization use case supports the collection and reporting of patient immunization data to the public health system, as well as providing vaccination monitoring capabilities. Healthcare organizations can query the Nphies to retrieve a patient's complete immunization record, known as an immunization card. The key benefits of this use case include providing clinicians with the necessary information to determine if a vaccination should be administered during a clinical encounter, as well as reporting to public health authorities when a vaccination has been given. Additionally, communicating the patient's current and pending immunization information, and capturing the details of administered vaccines to support reporting of any adverse events. The main workflow the healthcare provider will query using ITI 18 standard of specific or list of documents, and it will be retrieved using ITI 43 standard. In the upcoming section, we will explore the process of enabling single sign-on functionality to Nphies platform. The objective is to allow healthcare practitioners to be automatically authenticated and seamlessly access the patient's unified health record within the Nphies platform. The implementation of this SSO capability is based on the Security Assertion Markup Language, SAML, and its response. The participating healthcare organizations will be responsible for developing the SAML message response in accordance with the Nphies requirements. They will then integrate this SAML functionality into their own health information system, ensuring that the Nphies logo is displayed as part of the primary interface of the application. This SSO integration will provide a streamlined and secure access experience for healthcare practitioners, allowing them to easily navigate between the Nphies platform and the patient's health records maintained by the participating organizations. The SSO workflow starts when healthcare practitioners access the Nphies provider portal directly from their own application. When the practitioner tries to access the Nphies portal, the application will generate the required SAML response that was developed according to Nphies requirements. The application will provide the practitioner's ID, national ID or ICAMA ID, the patient's health ID, and the healthcare organization's ID as part of the developed SAML response. Then, Nphies Oracle IAM, Identity and Access Management System, will validate the signature of the SAML response to ensure it's authentic. Additionally, validate the provided practitioner, patient, and organization attributes in relation to the registries. Once all the validations are successful, Nphies will open up the requested patient's unified health record for the authenticated practitioner to access. To ensure successful integration, there are various references that are developed to provide you with valuable guidance and the necessary requirements. These references are designed to assist you throughout the journey, ensuring that you have all the information and resources needed to seamlessly integrate with the Nphies platform. First, the interface specifications document, which will provide the technical integration details that participant organizations would need to develop interfaces of either publish to or query for data from Nphies. Whereas for the clinical requirements of Nphies there is the mapping guide, which provides the clinical requirements details that participant organizations of the Nphies platform would need to comply with the clinical standards and required to be integrated with Nphies. In addition, the Saudi Health Information Exchange Data Dictionary, which provides the value sets that will unify healthcare provider data when it is exchanged to Nphies platform. In conclusion, thank you for your attention. Your time and focus are greatly appreciated. Looking forward to have a successful integration journey with your healthcare organization.